I'm sure that you have felt that moment in a session when your patient's body is present, but their brain has just exited the room. It's subtle. The polite nods, the non-committal, yeah, maybe. They're not necessarily fighting you. They're not intentionally fighting you, but they're not with you. You can tell. I'm Dr. Arwen Podesta, triple boarded in psychiatry, addiction medicine, and forensic psychiatry, and also functional psychiatry specialist, founder of Podesta Wellness. In this video, I will be challenging a common assumption that patient resistance is only about motivation. Often it's neurological. If the brain doesn't feel safe, or if it doesn't see a meaningful reward, it checks out. The good news? You can change that. There's a simple brain-informed strategy that invites the nervous system to stay present, building trust early, getting your patient's reward system on your team. That's what we're going to dive into today. However, before we dive in, if you're building a clinical approach that's both evidence-based and humanistic, download my free Professional's Guide to Addiction Treatment. This guide is packed with tools you can use immediately. The link is below in the description. Now let's get back to it. Okay, so here's the real challenge. Even when patients want to get better, even when they say they're ready, their brain just might not be on board yet. In Hooked, I talk about a simple equation: biology plus stress plus drug equals risk. That same mix explains why some clients disengage. Especially in addiction recovery, the nervous system is scanning for threat, not opportunity. And when we, as clinicians, jump straight into insight or advice before the brain feels subconsciously and consciously safe and rewarded, hedonic tone, as in dopamine tone, we unintentionally trigger disengagement. You'll see it in subtle ways. They glaze over. They offer short answers. They agree, but they don't act. And it's not resistance. It's just a mismatch of how we are delivering care and how the brain actually engages with new ideas and change. And that mismatch, it's quietly limiting how effective our sessions can be. Let me take you into a real moment. Recently, I was working with a very high-functioning professional who was in early recovery, sharp mind, deep insight, but every time we met, it was just flat. They showed up on time. There was no spark or curiosity, though, and no ownership of the process. They'd say things like, yeah, I know, I should probably track my drinking more, or, I know all this stuff, I've heard it before. And, on paper, it looks like they're showing up and they're doing the things they're doing, but in the room, there's just no engagement, just kind of survival mode, just nodding and checking out. So I shifted one thing. Instead of leading with my interpretation or with next steps or with my plan, I led with choice. What feels like the smallest thing you could experiment with this week? And at that moment, their posture changed. They sat up more. They actually engaged and thought about it for a second. And then they said, actually, I've been thinking about trying this breathing app before the meeting. And at that moment, their brain was re-engaging, not just because of what was said, but because of how I said it and what it triggered in the brain's safety and reward systems. So what changed in this session? What shifted them from passive agreement to active curiosity and follow-through? I didn't give a new worksheet. I didn't give a different diagnosis. It was something deeper and just more brain-aligned. I stopped asking their mind to comply and started inviting their nervous system to participate. And that's the turning point we sometimes miss. If we want patients to engage, we really have to speak their brain's language. So let's look at the neuroscience behind this and why that shift works and what system is activated and how you can start using it in every session easily. First, motivational interviewing speaks directly to the brain's reward system. In my book, Hooked, I describe dopamine tone as the brain's balance of reward chemistry. When that tone is off, especially in addiction, the brain demands relief before it even listens to insight. When we invite patients to choose their own next step, even if it's super small, we activate the mesolimbic dopamine system. And this is the part of the brain that lights up not just when we achieve a goal, but when we anticipate success. So when a patient says, I think I'll try that breathing app before meetings, the brain is actually already releasing a little bit of dopamine. It's kind of like dropping a little token into a jar. Every time they imagine success, the brain gives a little reward, not just for doing it, but for thinking about it and believing it's possible. But because it feels doable and is internally chosen, and that feeling really is defined as engagement. That's buy-in, and it comes from possibility, not pressure. And that's the brain saying, I'm interested, let's go. Second, those early achievable goals matter more than we think. When a patient succeeds, even in tiny, tiny ways, the brain starts building new pathways, new patterns. I can make a choice. I can follow through. I can feel better. And that's not motivation only, that's neuroplasticity. The brain is literally creating new pathways around agency and around reward. And that leads to more momentum, more trust, and more sustained effort in the therapeutic process and in recovery. Third, co-regulation creates the safety needed for all of this to even begin. Motivation alone isn't enough. The nervous system has to feel safe enough to even engage with the goal. This is where polyvagal theory comes in. Our tone of voice, our body language, the rhythm of our speech. All of this sends signals to our patient's autonomic nervous system. If we feel calm, grounded, and connected, their vagus nerve gets the message. This space is safe. I don't have to defend. I can explore. And that's when social engagement system activates. That's when the prefrontal cortex comes online and when real connection and insight becomes possible. It's not just what we say, it's how our body language speaks. And finally, metaphors and visuals to help the patient grasp the process. The brain is pattern seeking. It's an organ that's looking for patterns and it loves images. It remembers images. And so when we say things like, think of recovery like rerouting a trail through the forest, we're giving the brain some visual to hold on to. And that kind of image sticks. It turns an abstract concept into something concrete, something patients can picture and follow and remember. Suddenly, the abstract becomes actionable. We're not just talking about therapy anymore. We're creating a map the brain can follow. So when you combine these 4 elements, choice, early wins, nervous system safety, and visual clarity, you're not just running a session. You're creating a neurobiological yes. And that's what keeps patients engaged, what keeps patients coming back. And that's what makes change feel possible. So now that we understand why it works, let's talk about how to actually use it. Let's create a map for you. Because this isn't about overhauling your entire approach at all. It's just about making a few little tweaks, intentional shifts that align with how the brain engages, how trust is built, and how sustainable motivation actually forms. What I'm about to walk you through are 4 simple steps. Ones you can start using in your very next session. No extra materials, no gimmicks, just a simple shift in how we invite the brain to participate. So let's break it down. All right, let's walk through exactly how to bring these tools into your session. They're small, simple shifts, but they are powerful. No new materials, no big overhaul, just a few ways to work with the brain, not against it. Here's what to try. All right, step 1, let's start with autonomy. Instead of leading with a suggestion, start with a question. I might say something like, this week seemed to go so much better than last. So what's one small thing you did? And what's one small thing you could see yourself trying for next week? And then I wait. I try not to rush the silence. I just wait. Because when they come up with their answer, even if it's something tiny, their brain is engaging, it's getting involved, and that's where motivation starts. It's not about what we think they should do. It's about what their goals are, but also what they feel capable of doing. And it creates the spark of buy-in. Step 2, highlight the anticipation, not just the outcome. Once they name something, I like to gently ask, how do you think it'll feel if you follow through on that? I'm not looking for perfection. I don't want perfection to get in the way of good. I'm helping their brain rehearse success because that actually also activates dopamine before they even take the next step. You're essentially saying, hey, nervous system, this is safe. This is good. You're allowed to want this. All right, step 3, regulate yourself to co-regulate with them. This one's subtle but huge. Before every session starts, I try to ground myself. 2 feet on the floor, a few deep breaths, a physiological sigh, and then I show up calm, open, and present because if I'm holding tension in my shoulders, if I'm rushing, if I have a clipped tone, if my hand is on the doorknob, their body picks up on that before their brain even processes what I'm saying. So sometimes I might even begin a session with something like, let's just take a deep breath together before we dive in, just to land here for a second. You'd be surprised how quickly the room shifts. Think of your nervous system like a tuning fork. If you're grounded, you create a vibration their body can match. And that's co-regulation in action. Step 4, make it visual. After they've chosen a goal, we make it visible. I might grab a notepad or even draw on the back of a handout or write on a whiteboard, or often I'll have them write it out. I'll say, let's map this out a bit. That way, it's not just floating around in your head, and that way they have something tangible. And so we might write out Monday, try 3 deep breaths before that 10 a.m. meeting. Wednesday, send a quick check-in text to so-and-so. Tiny check boxes, arrows, anything visual. Because when they see it, the brain has a path. It's no longer just an idea, it's actually a plan. And then I might ask them to put it on their bathroom mirror so they see it every day, or put it near their coffee area or on the refrigerator so they can be reminded. This is requiring that I will have asked them about their daily activities so I know where that map can be used and most effective for them. And now there's a greater chance that they're going to follow through. That's it. 4 moves: autonomy, anticipation, co-regulation, and a visual map. They seem so simple, but neurologically, they change the entire feel of the session. They're the difference between talking at the mind and working with the brain. So let's zoom out for a minute. What we're really doing here is meeting the brain where it already wants to go. When we give patients a choice, the brain pays attention. And when we co-regulate, the body says, okay, I'm safe here. And we make things visual and simple. The mind can say, I can do this. Baby steps. It's not magic. It's not manipulation. It's just good therapeutic tools delivered in a brain-friendly way. And honestly, when you start practicing these shifts, you begin to feel the difference in the room. Patients lean in, sessions feel more collaborative, and progress picks up naturally. And as you start using this, here's something I want you to keep in mind. When we align therapy with how the brain builds trust, anticipate rewards, and finds meaning, we stop swimming upstream. Engagement isn't something we have to force. It becomes something we foster. It becomes easy. So if there's one thing to take away from this today, it's this. When therapy feels safe, rewarding, and patient-led, the brain wants to show up. But what if it's still not enough to help your patients reduce relapse? There's tons more we can do without adding complexity and without losing connection. Click on the next video right here on the screen where I talk about the reason patients relapse, even though they have all the right tools in place to work on. I'm Dr. Arwen Podesta. Thank you so much for your time.